The term PART, P-A-R-T, is a new diagnosis that we have categorized in our center and refers to polyhydramnios affecting the recipient twin. And this is specifically to differentiate from twin-to-twin transfusion syndrome. Remember, in twin-to-twin transfusion, the issue is that one baby is transfusing blood to the other baby, and as a result, the baby who is sending its blood off is very anemic and has low amniotic fluid because it's not peeing enough. The other baby who is receiving the blood is overloaded and the opposite of anemic and trying to pee off all that volume and has lots of fluid. So that's low fluid and high fluid at the same time. Now I'm reminding you of that definition because in contrast, when you have polyhydramnios or a lot of fluid in one twin, but normal fluid in the other twin, not low fluid, that's not the same thing. That high fluid in the other twin is not because lots of blood is being transfused from it from an anemic twin, because then that anemic twin would have really low fluid. So instead, if you have normal fluid and polyhydramnios, what's going on? And this used to either be managed as a non-entity, it sort of wouldn't be followed very much, or be mismanaged in some ways as twin-to-twin because it looked like the fluids were so different. But we have been following patients with these findings for quite some time and have seen that in fact the fluids may actually normalize over time, that close surveillance is the best way to go. In some patients, the polyhydramnios or the high fluid becomes really dramatic and extreme, and the pregnancy as a whole is at a risk because the uterus can only stand so much distension. And in those cases, it may be most prudent to actually remove some fluid with an amnioreduction. And it turns out that that's the best way to prolong the pregnancy, which is exactly what you need. A laser intervention may not at all be what you need because a laser is trying to fix transfusion from one baby to the other. That's not what's happening in PART. So it's very important to subcategorize these subtle findings, and we do this once your ultrasound is completed. We understand exactly how much fluid is around each baby and can generate a diagnosis. With the right diagnosis, we can come up with the right management plan for you.